Hi everyone. Now we are going to discuss about acute respiratory distress syndrome. First, introduction. Acute respiratory distress syndrome is a serious and potential life-threatening condition characterized by the sudden onset of reverse respiratory failure due to widespread inflammation and fluid accumulation in the lungs. It results in impaired gas exchange, reduced oxygen levels in the blood, and difficulty in breathing. ARDS, which is also called as acute respiratory distress syndrome, usually develops as a complication of an underlying illness or injury such as sepsis, pneumonia, trauma, aspiration, or severe infections. In these conditions, the tiny air sacs in the lungs, which is called as alveoli, become damaged, causing leakage of fluid into the lungs and making it difficult for oxygen to reach the bloodstream. Patients with ARDS often require intensive care management, including oxygen therapy and mechanical ventilation to support breathing. Despite advances in treatment, ARDS remains associated with significant morbidity and mortality, making early recognition and prompt management essential. The next we are going to discuss about the definition of ARDS. Acute respiratory distress syndrome is a severe life-threatening condition in which the lungs suddenly become inflamed and filled with fluid, leading to rapid onset of respiratory failure. It is defined as an acute form of non-cardiogenic pulmonary edema characterized by diffuse alveolar damage, severe hypoxemia, which is also called as low oxygen, and decreased lung compliance occurring within 1 week of a known clinical result. The next we are going to discuss about the causes of ARDS. ARDS can develop due to direct injury to the lungs or indirect injury from systemic conditions that cause severe inflammation. Direct lung injury, which includes this condition directly damage the lung tissue. Pneumonia, which means infection causing inflammation of the lungs. Aspiration of gastric contents, which results in inhalation of vomit or stomach acid into the lungs. Inhalation injury, breathing in smoke, toxic gases or chemicals. Pulmonary congestion, lung bruising due to chest trauma, near drowning, water entering into the lungs, and fat embolism, which means fat particles entering the lung circulation, often after fractures. The next one is indirect lung injury, which is caused by extrapulmonary. These conditions cause widespread inflammation that affects the lungs. Sepsis, which is the most common cause, severe body-wide infection, severe trauma or shock, acute pancreatitis, inflammation of the pancreas, massive blood transfusion, drug overdose or toxic reactions, burns, and severe allergic reaction, which is also known as anaphylaxis. The next we are going to discuss about the clinical features. The clinical features of acute respiratory distress syndrome usually develop suddenly and may worsen rapidly. The common signs and symptoms includes the respiratory symptoms are severe shortness of breath, rapid breathing, difficulty in breathing, use of accessory muscles for breathing, dry cough, and chest tightness or discomfort. Next, oxygen related symptoms due to hypoxemia called as low oxygen saturation, cyanosis, restlessness or anxiety, confusion or altered mental status. The cardiovascular signs, which includes rapid heart rate and low blood pressure, especially if associated with sepsis or shock. Physical examination findings, which includes crackles heard on lung auscultation, reduced breath sounds in severe cases, and signs of respiratory distress. Severe or advanced features, which includes fatigue and weakness, reduced urine output, respiratory failure requiring mechanical ventilation. Next, we are going to discuss about the diagnosis of ARDS. The diagnosis of acute respiratory distress syndrome is based on clinical evaluation, imaging studies, and laboratory investigations. Early diagnosis is important for the prompt treatment, which includes clinical assessment like history of recent illness or injury, example sepsis, pneumonia, trauma, aspiration, etc. Symptoms of severe shortness of breath and rapid breathing. Signs of hypoxemia, which means low oxygen level, such as cyanosis and low SpO2. Arterial blood gas ABG analysis, which includes low PaO2, which means partial pressure of oxygen, helps assess severity of hypoxemia, may show respiratory alkalosis initially. Next, chest X-ray, which shows bilateral diffuse infiltrates in both lungs, indicates pulmonary edema not caused by heart failure. CT scan of chest provides detailed images of lung involvement, helps identify extent of alveolar damage and rule out other conditions. Pulse oximetry, which measures the oxygen saturation levels, usually shows low oxygen levels. Berlin criteria, it is the diagnostic criteria for ARDS. Diagnosis is confirmed when all the following are present, which includes acute onset within 1 week of a known clinical insult, bilateral opacities on chest imaging, respiratory failure not fully explained by cardiac failure or fluid overload, impaired oxygenation, which shows mild ARDS 200 to 300 mmHg, moderate ARDS 100 to 200 mmHg, severe ARDS less than 100 mmHg. The risk factors of ARDS are the conditions or habits that increase the chance of developing ARDS. Patient-related risk factors are advanced age, chronic smoking, alcohol abuse, obesity, pre-existing lung disease, and weakened immune system. Medical conditions associated with ARDS are sepsis, it is the most common risk factors. Second one is severe pneumonia. Third, aspiration of gastric contents. Fourth one is major trauma or multiple injuries. Fifth one is acute pancreatitis. Sixth one is severe burns. Seventh, shock. And then last one is near drowning. The treatment of acute respiratory distress syndrome focuses on supportive care, treating the underlying cause and preventing complications. It is usually managed in an ICU setting. The respiratory support is the core of management. First, oxygen therapy, which starts with supplemental oxygen. Most patients require advanced support. The first one is mechanical ventilation. Second one is low tidal volume ventilation. Third one is low plateau pressure. And the next one is PEEP, which means positive end expiratory pressure, which keeps our alveoli open. The next one is prone position, improves oxygenation in severe ARDS. Next one is neuromuscular blockade, may improve ventilator synchrony in severe cases. The next one is ECMO, which means extracorporeal membrane oxygenation, which rescue therapy in refractory hypoxemia. Treat the underlying causes. ARDS is usually triggered by another conditions, so treating that is essential. First one is sepsis. Sepsis is treated by antibiotics and source control. Next one is pneumonia, which is treated by antimicrobials. Aspiration, which is treated by airway management and supportive care. Trauma and pancreatitis, condition specific treatment. Next, fluid management, conservative fluid strategy, improves lung function and reduce time on ventilator. Medications, the most common medications are corticosteroids, example dexamethasone, may reduce inflammation and duration of ventilation. Sedatives and analgesics improve comfort and ventilator synchrony, and vasopressors. Supportive ICU care are prevent complications, deep vein thrombosis prophylaxis, stress ulcer prophylaxis, prevent ventilator associated pneumonia, nutritional support, and the close monitoring of blood gases and oxygen functioning. Thank you.